And welcome to the January 25th version of the Board of Commissioners regular meeting. We are all assembled as a full board. I will call us to order. Thank you. First thing on today's agenda is adjustments to the agenda. Mr. Mokrahajski, do you have any adjustments to the agenda?
The staff does not have any adjustments. Thank you.
Thank you, sir. And to the board, I see none. Emergency business? None. Then we will move directly to public comments. Today we will take public comments in the order in which they sign up, limited to 3 minutes per public comment. At 3 minutes, I will signal you to summarize. And after about 10 seconds, the mic will possibly be shut off. So try to keep your comments to 3 minutes. If we will take all comments today. If you have additional comments that do not fit into your time allocated, please don't hesitate to send them via email to Diana Jones at the county. Ms. Jones, will you monitor the public comment queue?
Thank you, Chair Farr. Yes, at this time, I do see people have signed up for public comment. If you will raise your virtual hand at this time so I can see if you would like to present public comment. And once I see your hands go up, I will call upon you in the order that the hands are being raised, and we will begin your public comment. I will begin public comment today with Lisa Arkin, followed by Harry Sanger. Lisa, I will unmute your microphone and your timer will begin.
Good morning.
There you go.
Good morning, County Commissioners, Chair Farr, and I wish you all a good morning and thank you for allowing this public testimony. I'm speaking today about an agenda item you have in the afternoon, which is the adoption of a draft Lane County Climate Action Plan, Phase 2. And I first of all just want to thank the county for taking on the work of doing a climate action plan. So important. You all have great respect, lots of kudos for doing that. And I appreciate the work of the staff who have been diligently plowing through what it takes to address climate change. I also wanted to mention a few areas of the draft plan that could be strengthened. And so hopefully you'll be asking a lot of questions when that comes up on your agenda later on. I'll just mention a few because the time is short, but I did submit written testimony. One of the first ones is that there's a heavy emphasis on electrical vehicle rollouts in the climate action plan as part of how a community can reduce greenhouse gases. And true, transportation does amount for a significant portion of our greenhouse gases, but EVs are not the only thing we can be doing there. And it is difficult for low-income households to access EVs without a lot of incentives and things like that, and then access to cars that can go farther and charging stations. So we just want to make sure EV is part of the plan, but not overemphasized in the plan. We also want to draw attention to more work on recycling. The plan could use more incentives for recycling, more opportunities to recycle. Reducing and recycling is a major challenge that needs to be addressed, and we need to divert unused food that causes methane gas once it's in our landfills and other problems. Lots of plastic in our landfills, but I hope counties can work together with cities to do better at providing people opportunities to recycle and get in the habit. Also, the plan could look at local renewable energy, non-combustible, community solar could be supported. And the last thing I want to say with my remaining time is hopefully to make sure this measures equity and measures reduction and has regular check-in times to monitor the success of the plan. So you have an opportunity to review how it's going. So thank you again for tackling climate. We're all in it together. It's the big issue of our generations at this time, and I appreciate this opportunity.
Thank you, Ms. Arkin. Diana.
Thank you for your public comment. Our next speaker will be Harry Sanger, followed by Paul Metzler. Mr. Sanger, I will unmute your microphone and you may begin your public comment.
Good morning, County Commissioners and staff. Good morning, Chair Farr. When are you going to return my phone calls like you do for radical leftist constituents? Anyways, thanks for providing this forum for the public to be heard and ignored. Hopefully more of you will come to your senses soon, but I fear permanent damage has already been done because you thought your experts were smarter and more trustworthy than your constituents. I've been told you catch more flies with honey than vinegar, but we all know a fly's favorite food, and you've been feeding us a steaming pile of it. We need to have a frank discussion, and you need to respond to the people who've been calling on you for months to wake up and stop harming Lane County and our neighbors. We all know that pandemic response has taken a social, emotional toll on society. The question now is whether we look to the same incompetent leaders to fix the mistakes that many of you still fail to recognize, whether we elect real Oregonian heroes who will stand up for the injustices you have let seep into our community. Real, thoughtful people see through your diversity and inclusion ruse. You exposed yourself when you failed to consider the disparate racial impact of your vaccine mandate for county employees. This is a ploy used to garner public sentiment only when it behooves you. We see the hypocrisy between your words and your actions. In my neighborhood, the illegitimate Social Justice Committee attacked members of the neighborhood by issuing an edict against protests that they personally disagreed with. As an individual, I vehemently oppose this letter, and as a community member, I am saddened for my neighbors who now feel even more unheard and cast out because of the divisive nature of discourse our leaders have spread like a plague. The people are tired of our individual rights being trampled for the greater good. Freedom has been turned into a dirty word. Before we joked about COVID-19 84 bringing on Big Brother and Newspeak, but that joke isn't so funny now. Fortunately, we can still disconnect from social media and connect to each other in meaningful personal interactions for the greater good. Once digital vaccine passports are rolled out in Oregon, even this basic freedom will be infringed upon. In the spirit of meaningless letters, Lane County would write one to the state denouncing this communist control tactic now, before it becomes our reality. Mandates are falling left and right. England and France have both rolled back restrictions. New York's mask mandate was struck down in court. And even now, truck drivers are gathering in Ottawa to protest Canada's mRNA shot mandate. Around the world, people are speaking up against failed leadership. This past week, OHA held hearings on mandates. The public response was overwhelming. Not a plurality or a simple majority. Every comment I heard was against continuing down the road of social harm. What you called misinformation for months was presented in a logical, sometimes emotional, fact-based manner by hundreds of Oregonians, including a number of Lane County residents. The will of the people is clear. If you continue to ignore our voices and degrade our community and your vision of public health, we will not comply. We will fight your re-election campaigns, and we will use every legal avenue of redress and protest to be heard when you refuse to listen to common sense and politically inconvenient science. Thank you for providing this virtual forum. I look forward to your return to real meetings where you feel accountable to the people participating in the public process.
Thank you, Mr. Sanger. Ms. Jones.
Thank you for your public comment. Our next speaker is Paul Metzler, followed by Nicholas Anselmo. Paul, I will unmute your microphone and you may begin your public comment.
Good morning, commissioners, and thank you for this opportunity to speak. I'm here to address the issue of election integrity. There's many aspects of our voting system here in Lane County which raise some very grave doubts as to the trustworthiness of our elections. And I would like to address in some detail just one aspect of those irregularities. Voters who are inactive do not receive a ballot, but they can update their registration up until 8 p.m. on election day. The public record of the data roll shows 4,347 voters updated their registration on election day, November 3rd, 2020. The actual number would have been higher because this data is taken from the August 2021 data poll, and there would have been attrition in the intervening period. Of those 4,347, 1,357 voted on election day. Now, Oregon allows an inactive voter to be given a ballot at the elections office when they update their registration status. How did 1,357 voters receive a ballot and vote on November 3rd, 2020, when the county offices were on lockdown due to COVID? The elections office is required to be physically open up until 8 p.m. on election day, but County Clerk Betchert has said that hardly anyone comes into the office. How is it possible that these votes were honestly cast? We did a random test to check locations where the registration date was on election day and a ballot for that person was cast. Of the 27 people we talked to, 8 respondents stated that the voter does not live there. 3 respondents stated clear irregularities, and in 16 cases, anomalies were unclear if in fact any did occur. We are just not up to international standards. India, France, Mexico, Germany, Holland, Jamaica, Norway all have in-person voting with picture ID. The Dutch and the Germans have now eliminated computerized vote tabulation entirely on the grounds that it's not secure. I urge the commissioners to take steps to restore trust in our elections. I ask that the commissioners instruct the county clerk to improve and begin a process for voter roll maintenance. And thank you for your time.
Thank you, Mr. Metzler. Ms. Jones.
Thank you for your public comments. Our next speaker is Nicholas Anselmo, followed by Danny. Danny, I apologize, your last name is not showing. Mr. Anselmo, I will unmute your microphone and you may begin your public comment.
Good morning. I see we're still all behind screens. More evidence again as that mask and inoculations aren't working. Otherwise, we would be in person. This is just common sense, information. And I would like to point out that Jackson County commissioners have written a letter in opposition to the mask mandates, permanent
Ms. Jones,
mask
can you start the
mandates with
timer?
a
Mr.
$500
Anselmo, you
fine.
have 3 minutes from this moment. Ms. Jones, can you start the timer? Thank you.
You guys
You have 3
can't
minutes, Mr. Anselmo.
even function. You guys can't even function an online thing. Seriously. Again, so if these inoculations and these masks work, why are you still behind screens? This makes no sense. Jackson County commissioners put in a letter against the permanent mask mandates, which include a $500 non-compliance fine. This is 5 times the fine that you get for smoking meth and doing heroin. I'm very much against the drug war, and I feel that there's details in that need to be fixed, but it's outrageous to think that anyone would support a $500 fine for not covering your face. This is disgusting, especially considering one of our own county commissioners thought it was okay to be maskless in a place where that was required to be wearing a mask. So in that light, to repair the hypocritical action, I urge the county commissioners to join Jackson County commissioners against the mask mandates. Also, the vaccination mandates in healthcare settings and in school settings. In regards to the climate change, we need to have local energy. We need to have local energy production. It's not sustainable if you're getting your energy from halfway around the world. That does not make any sense. And just because something's not initially combustible from the creation of the energy from the sun or the wind doesn't necessarily mean that combustions weren't used and pollution wasn't created to create those products. This is a big misconception of the climate change movement. As an environmentalist and a permaculturist, I understand the importance of locality and the importance of having local ownership of our energy production in a sustainable fashion.
Thank you, Mr. Anselmo. Ms. Jones.
Thank you, Chair Farr. One moment. Our next speaker is Danny. Danny, I will unmute your microphone and you may begin your public comment.
Good morning, everyone. Danny here. I didn't write anything today, but I did want to come in and share a little bit of the experience of Thursday and yesterday. I did send you all the link to see, so that you can watch it live. I don't know if you did. It's been very disruptive for my work. I'm a director at a company, and I've been having to take days off because all these meetings are during business hours. So that's just not okay. But I'm gonna do it anyway, because you only get to fight for freedom once, and this is the time. So even if it's disruptive, I'm gonna keep participating. I just want you to know that there's been 15 hours of public comment from Thursday and yesterday. It's been, I am just filled with energy watching Oregon stand up. I knew that would happen because I am already in a bunch of these networks. I've been talking to you over email about we are the tip of the iceberg. And I think that this has been a demonstration of what I meant. Oregon, even though has been so left all this time, even though Antifa gets under our stuff every time we do something, because we're fighting that too, and they're very violent. We're not getting help from the police. It sucks. So anyways, it's been pretty fantastic to watch Oregon stand up. And I want you to know of a violation that OHA is committing. We've been studying them. We got lawyers. We are so ready for this. I'm not going to tell you all the details, but I do want you to know that we are not just a couple of people that don't know what we're doing, and we're catching them. So we're just letting them, do this. But there's a rule. It's called ORS 431-180, if you want to look it up. And the title of that rule is Interference with Individuals' Selection of Healthcare Provider, Treatment, or Religious Practice Prohibited. That is the name of the rule. And it says, I just do an extract for time's sake. Nothing in ORS 431-000, 550, or 990 or any other public health law of this state shall be construed as authorizing the Oregon Health Authority or any local public health authority to interfere in any manner with an individual's choice mode of treatment. OHA is breaking this. We're gonna shut down their mandates, and if they don't listen to the people, we're gonna shut them down. So OHA, we're watching you, and stop overstepping your boundaries. Luckily, your commissioners are not overstepping theirs so far, which is very awesome, but we're keeping track of it all. So thank you very much. Have a good week, and thank you for the space to speak. Take care.
Thank you, Danny. Ms. Jones?
Thank you, Chair Farr. At this time, I do not see any other hands raised. If anyone else has signed up for public comment and they would like to speak, please raise your hand and I will call upon you. I do see another hand went up. I see two. Ibarra Taher, I will unmute your microphone and you may begin your public comment. You will be followed by Elizabeth Cable. Ibra, you may begin your public comment.
Hello. Do you hear me now? Can you hear me?
Affirmative.
Yes.
Yep. Well, my name is Ibra Taher. I'm from Eugene. Actually, I'm a native Eugenian. I was born here. I haven't participated in any commissioners meeting before for one reason. I don't know if my voice will be heard. I don't know if that's something that really can the commissioners and board consider. When I talk, when I explain my position, I don't know. Anyhow, it's been 2 years of frustration and disappointment. What we are witnessing right now is the public is distant from the leaders that make policies that intervene in their lives. What's going on in the entire world is very similar to what we are experiencing here in Lane County. But usually we think when we talk about government roles, we ask what are the limits that the government can have when it comes to individuals' liberty. We know that the scientific literature now about COVID, if we want to take it lightly, we can say it's not settled because thousands of scientists have different opinion than other thousands of scientists. So we want to ask that question. What justifies these policies that the board adopted 2 years ago. If it's a scientific thing, then it's not settled. If it's a convention of the board, that means that you can force your convention on people, then again, what justifies that? I would like to read you one of the things that has been violated since March 2020, which is the Bioethics Convention of the UNESCO in 2005. I'm going to read only one section of it. In no case should a collective community agreement or the consent of a community leader or other authorities substitute for an individual's informed consent. So when we locked down everything, when we forced these mandates, when we really harmed people psychologically, physically, how is it possible and justifiable under these laws, under these ethics? So we would like just to ask you to consider these emergencies that you've been imposing. Thank you so much for the time that you've given me.
Thank you, Mr. Ter. Ms. Jones.
Thank you for your public comment. Our next speaker will be Elizabeth Cable, followed by Dawn Buell. Elizabeth, I will unmute your microphone and you may begin your public comment.
Yes, good morning to everyone. I am just so grateful to have this opportunity to address the ladies and the gentlemen of Lane County Commissioners. I was born in Eugene, Oregon in 1966, and I have been a resident of Lane County for the majority of my life. I have 4 generations buried in Brownsville and 2 generations buried here. My grandfather was Barney Cable and ran what is now the Good Times under the Franklin Street Bridge as Cable's Cafe for years, almost 40 years actually. I've witnessed small businesses come to destruction locally over the past couple of years. And there were inklings that this kind of issue was going to hit our community as I watched more graffiti go up and more homeless people come. And then the legalization of heroin and methamphetamine and drugs in general has been overwhelming, I think, to our communities and to the safety of people. Mostly, I just want to say thank you all. It's really an honor to speak to the people that represent me here in Lane County. I want to be proud to be here. I want to continue to be here in Oregon. And, all the whispers of the choices that the government has made in Salem and the OHA is making out of Portland, and unfortunately, possibly even here in Lane County, has been really rough to witness as an Oregonian. And, to see Rick Dancer move away from Oregon scares me, because he really put in an amazing fight with his life here, being born and raised and trying to speak for people. And he has left us. And, unfortunately, I feel like a lot of people are leaving Oregon right now. And I don't want to be one of them. I don't want to go to Florida or go somewhere where I think I can be more free, because I'm here and I was born here and this is my land and these are my people. I'm one of the people of Lane County. I'm one of the people of Oregon, and therefore one of the people of America. And so I'm going to keep following and watching. I'm more alert than I've ever been. And I want to support the freedom of truth. And I want to thank everyone who's spoken today. And I'm joining forces with us all. And I hope that you can represent us here in Lane County, represent my voice as you've heard it here today. And I thank you all so much. Let's have a better year. Let's move forward. Please rise up and do the right thing for the people, and most of all, the children of Lane County. Thank you very much.
Thank you, Ms. Cable. Ms. Jones.
Thank you. Thank you, Chair Farr. Our next speaker is Dawn Buell, and that is the last speaker I show with hands raised. Dawn, I will unmute your microphone and you may begin your presentation. Dawn, I do show yourself muted. Dawn, I don't know if you see a button that allows you to unmute, but we are not hearing you.
There we
You
go.
are
Is that
self-muted.
working?
There you go.
Okay,
Yes.
it must. I see a bunch of smiles. Thank you, gentlemen and ladies. Appreciate the
Ms.
opportunity.
Jones, can you restart the timer, please? I'm sorry. And
No,
Mr. Buell, you'll have 3 minutes.
thank you, commissioners. Appreciate the opportunity to give you feedback from the community. My name is Don Buell. I'm Vice Chairman of Lane County Republicans and Chair of the Lane Election Integrity Committee. And after the last national election, we heard many people concerned about their vote counting or not counting, not trusting the outcome of it. And so here's our concern, that every American should have the opportunity to vote regardless of the outcomes of that. We want voting rolls to be clean, accurate, and open. The citizens of Lane County should feel confident that their vote counts. To that end, we got a list of registered voters in Lane County and started knocking on doors, asking for persons registered to vote at that address. Guess what? They were not there. They were not even known. So where did their ballots go? And who cast those ballots? According to the law, everyone must list their living address showing proof of the residency where their ballot is to be sent. Not happening. Some of the addresses were the Walmart parking lot, general delivery, address XXXX, OR as the only address. No address on files, at least 36 people there. So what happened to the ballots? Where were they delivered? To the parking lot. Who got them? More importantly, who voted? There are other notable addresses. 1995 Amazon Parkway. 70 people registered there. And over the history, no one's ever lived or dwelled in that building. It's on the same property as South Eugene High School. 70 people there. 1542 West First Avenue, that's Eugene Mission. There's over 330 people registered there, and having talked to the director, she assures us that no, not that many people are there. How about 341 East 12th Avenue? Nope, 110 people supposed to be living in there. That's Whitebird, according to the manager that we talked to. And we've gone to all these sites. We've talked to the people. Not that many people there, 110. No, there's 300 and some, according to this individual. As a result, we submitted letters to challenge the Lane County elections, and we asked that they follow the rule of law. The challenge letter stated it started in October, and we have yet to hear back from them. As the commissioners are responsible for their function, that's why we're bringing this to your attention. We had offered our teams, to help the county should they have questions or need something investigated. Our concern is, as an American, we want every eligible voter the opportunity to vote. This is a bipartisan issue, regardless of how you vote or how it comes out. That's the American right. We're not only the ones—
Please summarize.
I'm sorry?
Please summarize.
Summarize, yeah. Lane County has a pre-suit filed by the Judicial Watch because 10% of America moves every year. That would mean hundreds of people in Lane County should be changing their addresses. That's not happening. They were given 90 days to correct that. So we're
Thank you,
asking—
Mr. Buell. Ms. Jones, we'll move along with the agenda now.
Thank you.
Thank you, Chair Farr. I will return the meeting to you.
Thank you, Ms. Jones, for managing the queue. And thank you for all the participants who provided testimony today. And a reminder to you and to those who did not, that written testimony is always accepted. Please forward that to Ms. Jones at Lane County's address. We'll take a few moments right now, commissioners, for your responses and any other public comments or issues or remonstrances you may have. And I will bring up my queue here, and I'll follow the hand raised in the queue. I see no hands raised. And we will move along to, at this point, then we will recess the Board of County Commissioners, and at the sound of the gavel, we'll convene the joint meeting of the Board of Health and Board of County Commissioners. Welcome to the joint meeting of the Board of Health and Board of County Commissioners. We first have on our agenda today the adjustments to the agenda. And to the administrator, Mr. Mokrahisi, are there any adjustments to the agenda?
There are not.
Thank you, sir. Any emergency business? I see none. Then we'll move directly to item 3 on the joint meeting of the Board of Health, Board of County Commissioners. And it's a discussion on COVID-19 response and recovery. Ms. Mokrahisi, I will ask you to introduce our panel.
Thank you, Chair. We have Steve Adams, our incident commander for COVID-19 response in Lane County, and Dr. Jocelyn Warren, our public health manager. And I'm just going to go ahead and turn it over to Steve to walk through the update for you.
Thank you.
Chair Farr, commissioners, good morning. I wish you all a good Tuesday. So I will just be pulling up my screen here. Okay. All right. Okay, so let's see. So I began this morning reporting data that we posted yesterday. With yesterday's case report, we were reporting as of 8 a.m. yesterday morning, 277 new cases in the 24 hours prior. That brought us to 46,166 on the pandemic as a whole. We are just posted this morning's new data, and the new cases being reported are 346 atop these 277. One thing I want to note is that these case numbers are coming at us at a pace that is absolutely unprecedented. In fact, it's coming at us so quickly that are the state OHA systems that we are required to use to track infectious disease, OPERA in particular, is really groaning under the strain. So we have had issues over the last several weeks, but just to put this in context, my last briefing for this board was on the 11th of January. We've reported 9,124 cases since that time. Just from the beginning of the year, 13,427 cases just from the beginning of just January, 25 days ago. And 14,849 since the 21st of December, which is really the point at which we began to see a step change in our epi curve moving forward. So we're currently reporting 1,378 cases per 100,000. That's tantamount to 1.4% of our population walking around with COVID at the current time. So that case rate is quite high, and it is certainly unprecedented for the period of the pandemic as a whole. Certainly, this epi curve helps to show that in context. What was last year's winter surge, the most prominent feature on this epi curve for months, until we experienced the Delta surge in the fall, put that into context. And now the curve here that we're seeing with Omicron continues to climb. I'm pleased to report that so far we are continuing to see here in Lane County the same sorts of observations that individuals elsewhere have reported in Europe, elsewhere with respect to disease severity. So last Wednesday, we pulled the data, and that was about 4,000 cases ago, last Wednesday. We looked specifically, we called that the end of week 4 of our Omicron surge, and just wanted to compare that to what did the end of week 4 look like for Delta. So at the end of week 4 for Omicron, we were looking at 10,949 cases. Again, this is last Wednesday. At a similar point at the end of week 4 of Delta, we had logged 5,791 cases. we had much more confidence in the number of Delta cases reported as opposed to the Omicron cases, because we're seeing a growing prevalence of at-home test kits now than we had in the fall. So we think that the number of Omicron cases are even greater than what we are reporting. At the end of week 4, for the Delta wave, we had 138 individuals in hospital here in Wayne County. Last Wednesday, we had 66 in hospital. At the end of week 4 of the Delta wave, we had 47 individuals with COVID-19 in ICU beds here in Wayne County, and occupying 76% of our ICU bed capacity. As of last Wednesday, we had 11 COVID-19 patients in hospital, occupying 18% of our capacity. So almost twice the cases, and certainly less than half the individuals in hospital, and really a quarter of the individuals in ICU beds, as you compare Delta with Omicron. So, as we had concerns, specifically the sheer number of cases of Omicron is what's driving the numbers here. So specifically, we are looking additionally at some of the severity numbers, and we've talked in weeks past specifically about issues and of people coming into hospital for other kinds of treatment, specifically coming in for elective surgery and other kinds of healthcare procedures, and then having COVID detected only once they're in hospital. So we dove in and looked specifically at our data. This requires a case-by-case hand count. So we did this yesterday. We had 62 Wayne County residents in hospital yesterday. 46 of those 62 were in hospital for COVID reasons. They were there because they were ill with COVID and seeking treatment. But the other 16 were individuals who were in hospital and were detected for other reasons and were detected to have COVID. So that's about 74% of our 62 were there seeking treatment for COVID. So so coming back to then the questions around breakthrough rates. So yesterday, when we looked at the 62, we noted that we were evenly divided. 50% of our hospitalized were fully vaccinated individuals, and thus breakthrough cases. We don't know about their boosted status specifically, but we know that they were breakthrough cases. Now, we continue to track these data, and as we look to try to track the sheer volume of cases, we're noting that some of the automated state functions are starting to break down because of the number of cases. So for instance, the automated breakthrough case report is not as reliable at the statewide level as we have seen in months past, and that is really a volume issue. Our data team are working extremely hard to try to stay on top of the data that are coming at us. We are looking for the peak. We are continuing to look specifically at a hospitalization peak within the next few days. It has been difficult to actually see a smooth flow of data. We have gotten data coming to us in lumps. We get big data drops on one day, and then we get low case numbers for a couple of other days. But we continue to be hopeful that that's the case. So doing what we can do, we can really just weather this storm coming at us. And we see evidence, certainly on the East Coast and the upper Midwest, that cases are appearing to peak and fall off. So we hope to see that pattern will show up here. What we can do as we weather this storm is continue to support those seeking vaccination opportunities. I'm pleased to report that we're now over 71% of our entire population has chosen to go for a vaccination and help us move forward. So we specifically are looking at our various populations here, and you can see that the youngest population, 5 to 11-year-olds, which we put considerable effort into late last year, 34.9% of that age group is now fully vaccinated. We are looking specifically at boost doses, and we continue to provide opportunities there. So for our 65 plus population, we are looking at 60.5% are boosted. So that leaves 18,600, just a little more, that are 65 years and older who are fully vaxxed but not yet boosted. And we are urging those individuals to get boosted as soon as possible. Individuals who are in the next age group down, 50 to 64, we're reporting as of yesterday, just over 41% of that group is boosted. That means we have just over 23,600 who are fully vaxxed but not yet boosted. So we are urging those individuals to seek treatment there. So those, as we look at nationwide data about Omicron, we continue to see that those individuals who have come back for boosting are performing quite well. A 90% boost protection rate really is continuing to provide that degree of durability as we move into this particular phase of the global pandemic. We continue to provide opportunities. We have mass vax operations at Riverbend Annex, and later this week at Autzen Stadium restarting with support from our partners at the Oregon Health Administration. And we likewise are moving specific assets to make testing more broadly available in the community, and then to provide distributed clinic opportunities to provide vaccination access right across Lane County. And that, Chair Farr, is my briefing for this morning.
Thank you, Mr. Adams. Very thorough. A little bit chilling news, but perhaps good news on the horizon that we're seeing a plateau on the East Coast and in the Midwest. At this point, I will open the queue for the Board of County Commissioners questions. And I'm looking for virtual hand raises. I see none. Then I'll begin with a question regarding the plateauing that was, I'm sorry, Dr. Warren.
I see Commissioner Bozovich and myself both have hands raised.
I see that now, but Dr. Warren, I'll turn the mic to you for a second.
Thank you, Chair Farr. I just wanted to draw your attention to the commissioners that had their hands raised. Thank you.
And I'm scrolling up and down. I do have that in order. Commissioner Trieger, followed by Commissioner Bozovich. Thank you.
Thank you, Chair. I'm happy to defer to Commissioner Bozovich. I think we were all just waiting to see who wanted to get in there to get the conversation rolling.
Then we'll reverse the order. Commissioner Bozovich, then I see only Commissioner Bozovich now.
Yeah. Thank you. I just was having trouble finding the toggle to raise my hand virtually versus raising my hand this way. So looking at I was happy to hear some of that comparison with the Delta surge numbers. I'll once again ask whether or not we can get trending data on hospitalization and death data versus just the entire, we're seeing, the disease severity detail is all we're getting, which is a snapshot today of the entire pandemic, or it's a snapshot. The hospitalization's a snapshot of what today's hospitalization is. Those data points have never been presented on a timeline. And I asked about this last time, Steve, and I'll just request it again. That comparison between Delta and Omicron on hospitalization and ICU usage was eye-opening, because we are seeing such a, and it was what I, understood from, South Africa and other countries that had the surge first, was there was a extreme difference in disease severity between the two. And we're seeing that right now, although hospitalizations lag cases, we all know that. So we'll, next week will probably tell to a certain extent, but it just doesn't seem to be. And part of that not only is, boostering and the amount of people getting vaccinated, but there's also been continually advancements in the treatment, for people that prevents them getting in the hospital in the first place, and the ability to treat otherwise. I do believe we're probably seeing a much higher case rate partly because the unreported in-home test rates, but also the in-home test. Dr. Lugke's admitted this, and I was listening to an interview with an immunologist. Lots of false negatives. So that those folks that might be doing in-home tests may actually have COVID and do the test either improperly, stored improperly, or whatever, and come up with a false negative, when they probably had Omicron. And I'm glad you went over the hospitalization with COVID data. That was one thing I did ask for, and I want to really appreciate the fact that you did that research and at least looked at a snapshot. But one of the things I heard a story on this morning is we're actually seeing a failure to discharge in a timely fashion at hospitals, where people are ready to discharge they're healthy enough to go to a lower level of care. And that's not happening because staffing shortages due to isolation protocol staff that have tested positive, and other issues with general healthcare worker staffing. So it'll be interesting to see if that actually kind of inflates some of our hospitalization numbers as we're not discharging people in a timely manner. All interesting data points to watch. But I want to appreciate the fact that you did that little comparison with the Delta surge, and that you did actually look into the issue of hospitalized for other reasons and then tested positive, and versus people that were taken into the hospital purely for the COVID infection. So thanks for that data, and appreciate the work you all are doing. This has been a long haul, hasn't it?
Thank you, Commissioner Bozievich. Any response, Mr. Adams, Dr. Warren?
Chair Farr, just multiple points there, really to touch base. I certainly heard Commissioner Bozievich's request previously, and I just want to note the staff are really flat out with these data, and our epi team in particular have been just crushed. So it was a minor coup to have enough case investigation time to actually do a deep dive at our hospitals to really kind of get to that. So I do want to work on the hospitalizations over time. So I want to assure you, Commissioner Bozievich, that that's the case. The failure to discharge piece is we are seeing that, and I'm confirming that that is a case here in Lane County. We have seen that as of Friday. Our hospitals were continuing to provide elective care at both of our hospitals. It continues to be a day-by-day decision-making process. For Peace Health, that was Riverbend is the only hospital in their system that is currently able to do that, and that's good news, and being able to provide that data. But certainly discharge to skilled nursing facilities in particular, for those patients, that is a challenge, and that has been for months and months, just from a staffing perspective. I think I'll leave it there, Chair Farr.
Thank you, Mr. Adams. Dr. Warren.
One other issue that we're working with is the availability of antivirals in the community. And you noted, Commissioner Bozievich, that there are new antivirals and new drugs that are very successful in the treatment of severe disease. They're not always available, and to the extent that we'd like them to be. And we're happy to bring back next time a more complete report on those if you're interested.
Thank you, Dr. Warren. That would be of interest. Commissioner Bozievich, thank you. I have in the queue Commissioner Trieger.
Thank you, Chair. Thank you for the presentation, as always. And I think someone used the word sobering, and I second that. It just had me thinking about this, the differentiation between hospitalized for versus with COVID. And I know this is an imperfect way of thinking about it, but I'm just remembering a good longtime family friend of ours who passed several years ago, of an aggressive lung cancer. And the way that lung cancer was diagnosed was he was in a minor car accident. And when he was taken in by the EMTs, he had a chest x-ray because he was complaining about pain when he took a deep breath, had broken ribs, but they also discovered his lung cancer, which, as I said, was very aggressive. And within 6 months, he was gone, and that diagnosis allowed him the time to plan for that and act accordingly. And so he was taken to the hospital because of a car accident, but then a cancer was discovered, and then both things had to be treated. And he was still a person who was receiving treatment and receiving medical care. And of course, the difference with COVID, with it being so highly transmissible, is it's even more of a burden on the healthcare system in terms of the intensity and type of care that's required and what it takes healthcare professionals to do as they move from patient to patient and room to room. So not all hospitalizations are the same. And to my mind, the burden on the healthcare system and what our healthcare professionals are going through, it doesn't change depending on what the presenting issue was. And a positive case is a positive case. So I just offer that up as a bit of perspective and framing for that. So I think it's interesting to sort that data by category, but I'm not sure it's particularly meaningful when it comes to the crisis that we're facing with the care system and the rampant spread of the virus continuing in our communities. My main question is, I'm hearing more and more, again, right? The more things change, the more they stay the same, about really high cases in the U of O community, and about how individual classes determinations are being made whether to go online or stay in person, are being placed with individual instructors rather than as a policy of the institution. So I'm just wondering if we are back in any regular contact and if public health is providing any advice to the institution of the University of Oregon on their practices to help contain the spread in the broader community.
Chair Farr, Vice Chair Trieger. To the University of Oregon question, indeed, we continue to work very closely with the university, both in terms of a daily reporting of cases as they are discovering them, to working collaboratively to provide community testing more broadly. So we are working closely with the university. So the university continues to operate under CDC guidance for a fully vaccinated campus. And now that OHA and Governor Brown have rolled back specific state level guidance, they have pointed to the operative CDC guidance. And we have walked through, Dr. Ludke has spent time providing reviews and recommendations to the academic side of the university as well as the athletic side. And to my understanding and knowledge, they're implementing specifically the requirements that they have under that CDC guidance and working within the parameters for infection control as suggested by Lane County Public Health. So I feel like there's a fair degree of transparency in terms of operations at UO and some of the decisions that they make under the guidance that they have. I would note that we have seen the peak in UO cases. That number of cases on campus is coming down, and that's, we have said internally, we hope that that's a sentinel for the rest of the community. They were a high beacon early in this Omicron wave, but they've already begun to come down pretty significantly.
Okay, thank you. Yeah, it's a concerning population, not only because of on campus, but the degree of socializing, and of course, many students who work in public facing jobs when they're not in class, right, in restaurants and so on, where more and more people are unmasked because they're eating and drinking. And of course, many of them are also parents and their kids are in childcare. And so just that community spread, it just seems like a containable place. And so I have some concerns, anecdotally, of what I'm hearing about the conditions on campus in classrooms where people are pretty close together for long stretches of time without good ventilation. So thank you for that. Appreciate it.
Thank you, Commissioner Trieger. Mr. Adams, we'll move along with Commissioner Burney next in the queue, followed by Commissioner Bozovich. Is that for a second round, or is that a ghost queue? Ghost, thank you. Then just a time check for everyone. We're in good shape right now. We have about a 45-minute item on unhoused population initiatives before an 11 o'clock time certain executive session. So Commissioner Burney.
I'm sorry, Chair, you took all my time. I'm just kidding.
You have this much time.
Thank you very much, Chair. I will say that, you know, over the years, Commissioner Bozovich has assisted me, and I was really looking forward to assisting him take his hand down. But you beat me to the punch on that one, too. Several things. I'll try to do this quickly. One, Steve, you started this by saying you were proud to say that I think about 71% of Lane County residents were in some form of vaccination protocol. Hasn't it pretty much been close to that for quite a long time now?
Chair Farr, Commissioner Burney. So we have been in the 70. We crossed the 70% range in about mid-December, and we're now over 71%. So we're making slow but steady progress.
Right, incremental but steady. Slow but steady. I'm going to request your next presentation you bring out the map that showed zip codes and gave us a difference. That would be helpful for me. I also want to just make a statement that gets away from the data geek stuff. Although as it relates to that, in my business that I retired from, oftentimes when we were dealing with vendors or groups that said they were trying to sell their stuff and they had the capacity to do this or that, what we did as a business strategy was try and break their system. And we tried to break their system so that we could understand what their capacity was, so that they could fix it with lots and lots and lots, high quantity of what they said they could do. And when you talked about OHA's system breaking and looking at the capacity of this, I found that very insightful, because this is exactly how you learn what your system needs to move forward. So it's too bad, but it's inevitable given the Omicron data you're sharing with us. Here's the statement that I would like to make, though. It feels to me like we also, I'm sure you are doing this, have some plans as we transition from pandemic to endemic. As we inevitably at some point are going to move to treating COVID as we treat the flu, with boosters, you know, depending upon a variant. I mean, and we're going to live with it. I do not see, I hope I don't, but I don't see any more mandates saying businesses are going to close. I don't see mandates talking about schools closing. But let me just share, here's what I do see. I do see that we've gone through this 2-year exercise. As Jay said, this has been a long haul. I mean, it's been a long time. No matter political or scientific or whatever stripes, everyone's exhausted with this, just tired of it. I think we're at a point where we're going to reach the level of, we're going to always have vaccines available, and this is probably what needs to happen, right? We need to get vaccines and boosters, and people need to do that, but we can't force them. I'm in the highest risk group, and I still am getting to the point where I am comfortable going to my gym where there's a lot of young people that aren't wearing masks, and either if it's too crowded, I leave because it's my choice. I'm wearing a mask. If it's not too crowded, I'll stay away, and I can make personal choices about where I choose to go and where I choose not to. I think we're reaching a point where really it's going to be, I have a granddaughter that has some learning disabilities, and the fact that she can't see people saying words and she can't see the faces of other children as they're interacting is absolutely stunting her development. There's no question about it. And with other grandchildren, I'm seeing some of the social isolation. So I'm sorry, Chair, I'll wrap this up by asking staff, I think we're reaching a point where it's going to be personal responsibility and consideration no matter what one's choice is, to be respectful of that. I think we're reaching a point where we're only seeing incremental vaccine increases, even though the hospital data, Steve, correct me if I'm wrong, is telling us that if you're vaccinated and boosted, your symptoms when you get it aren't going to require as much hospitalization, much less ICU. So it's protecting those that are vaccinated, and those that are in those areas are largely unvaccinated. Is that correct?
Chair Farr, that is correct. So those who are fully vaccinated and boosted have significant degrees of protection over
So
those
here I
who
am.
are not.
Thank you. Here I am in the highest risk group. I'm starting to get comfortable with masks or no masks and what my personal behavior is. Businesses are going to start choosing whether they require masks or not, and people are going to choose whether they frequent the business or not. So all that talk, are we starting to look at preparing after this last wave, and how so for this to be endemic rather than pandemic in terms of our responses?
Chair Farr, Commissioner Burney, indeed. We have for months been looking specifically at what a long-term COVID program would look like outside of emergency conditions. That work began almost a year ago, in fact, in the spring. We then had Delta and dealt with that. And then just as Delta's going away, Omicron. But nonetheless, throughout that period of time, we have continued to think about what that looks like and how we continue to provide other sorts of services to the public around public health.
Chair Farr, Commissioner Burney, if I may, I absolutely agree that there's going to be a lot of personal decision-making involved in evaluating individual risk in particular situations. And I know that that's been part of Jason Davis's sort of communications for several weeks now also, that, you know, given now that we don't have the state mandates that we've had, there is a high degree of personal responsibility involved. The one piece that I want to make sure that that public health is kind of involved in is ensuring that people have the right information. So in order to be able to evaluate your personal risk, you also have to have reliable information to do so. So being able to evaluate whether or not it's safe for you to go maskless indoors, you know, requires a certain amount of savvy and understanding of the current science. And so it is, I think, also incumbent upon public health to ensure that that type of information is being communicated broadly and well, so that people are able to make those decisions with some degree of confidence.
Thank you, Dr. Warren.
Thank you, Chair, for allowing me to ask that. Thank you, Steve and Jocelyn. We haven't had the opportunity to hear that because you're always dealing with one variant after another. So that's reassuring to me. And if I may, Chair, since I was just there this morning, I really kudos in this environment to Mackenzie Willamette. Their staff, their nurses, their paraprofessionals, their management, going there now under these circumstances, other than I couldn't bring my wife with me, is still a top-notch healthcare experience, and I hope that we can't lose that. So thank you so much, and thank you, Doctor, and thank you, Steve.
Thank you, Commissioner Burney. We'll move along, and I see Commissioner Buck, your hand is not raised, but I'll offer you the opportunity if you have questions.
Thank you, Chair. A lot of people have asked the questions I normally would have. I'll just reiterate, I'm interested, as Commissioner Burney asked, on you know, the increase and changes in who's getting boosted where. We know it's been exceptionally challenging to get folks in rural areas their vaccines, as we've seen lately, and our unrepresented communities. And so I am curious in future meetings if we could see that information again. Appreciate it. Thank you.
Thank you, Commissioner Buck. Then I just have a couple of quick things, and before we summarize, I'm going to pretend a little bit to be one of the people that I see on the street here in the vicinity where I live. You know, I've lived within a few hundred yards of where I'm sitting right now at home for almost 40 years. Consequently, both my wife and I are pretty recognizable in this area, whether we go to Albertsons or we go to Winco or wherever we happen to go, we get questions. And so I'm going to ask some of the questions that that I'd like to be able to give answers to. The first one I'm going to ask about is our website. I like to direct people to our website, and I'm on it right now under novel coronavirus. To get there, I click on news. So if I click on news at the masthead of our website, it takes me to novel coronavirus COVID-19, and we have a whole lot of links in there. My question is a simple one. How up to date are we on the links? Is this something I can, with confidence, direct people toward for as close, accurate information as they can possibly get?
Chair Farr, we work extremely hard to keep the website up to date with shifting federal and state guidance that often changes very rapidly. Maybe we're a day behind, and I will confess that we have been, but we try to keep that as up to date as we possibly can. It is up to date right now.
Excellent. One question that I get is right at the top of the masthead, once we get to novel coronaviruses, to jump to information on third and boost doses, click here. Can we rely on that being fairly accurate?
Chair Farr, indeed.
Excellent. And that gives me a great deal of confidence. Then the next thing I will ask, and I'm asking the question for, considering I'm somebody who would ask me the same question. If I feel symptoms, fever, I got a dry cough, some of the classic symptoms, what should I do?
Chair Farr, you should seek testing to seek. If you have a coronavirus or if you have some other respiratory ailment. And you should, until you know, you should wear a mask and you should limit your interaction with other individuals.
Excellent. I'll write that down and pass it along. That's good information. Second is if I don't test positive, I bought a home test. I got one on the cheap. They're pretty inexpensive. I Googled it and it said it's fairly accurate. It's negative. Great news. Now I can go out. Is that right? Or should I prudently test myself a second time?
Chair Farr, you should. Most test kits come with actually 2 tests, and the guidance for all of the FDA approved test kits are to take that second test kit, wait whatever the increment of time. It's usually more than 1 day, 36 hours, and not just do it one night and wake up in the morning and say that's the next day. Really give it the sufficient time, follow the directions in the lab kit in order to ensure that gives you the proper guidance.
Read the directions. I would never do that. Then, okay, bad news. I did test positive. Should I test a second time to see if it's false positive?
Chair Farr, if you've tested positive, you were positive. With a home test kit, you have sufficient, you have antigens in your body that are being produced by the virus. You do not need to seek confirmatory testing. You don't need to go out. You can report to us, and we encourage you to do so either through our call center or through our website. We have an online form. I have tested positive. Let us know that your home test kit has told you that you were positive. You will get guidance about what you now need to do with respect to a 5-day quarantine period. Help you. We have an online calculator to help you identify what your 5 days ought to be. And if you have specific questions about perhaps family members that might need to quarantine, depending upon your specific circumstances, there's additional information on our website. Of course, individuals can call our call center and get much of the same information. And we encourage individuals who need assistance successfully completing an isolation period to call us and let us know so that we can arrange for a grocery delivery or pharmacy delivery for you to help you get through that 5-day period.
Perfect. And as I scroll down our website, I find toward the bottom, I do find the call center, which is a 682-1380 number. Then back to something that you said. I have tested positive. Who should I tell? You say there's a place online to register that. And I'm not seeing that real evidently.
So I'm not on the website, Chair Farr. It is under isolation and quarantine, as I recall. Okay. And I believe it should be there is one of the links. I don't recall off the top of my head, sir.
That indeed took me directly to it. So click on isolation and quarantine. That takes me directly to the reporting. Then I've reported it. I've told the people I've been in contact with. What should I do now? What is my protocol regarding my weathering the disease?
So, Chair Farr, 5 days quarantine at this point. Lay low, take it easy, read a book, catch up on correspondence. You're fully vaccinated and you're boosted. You're probably feeling all right, but just take a few days off. And at day 6, get back to your life with a mask.
Or conduct Zoom meetings through those first 5 days if you can sit at your chair and look at your screen. Okay, excellent. That satisfies my questions. You've given me a lot of armor to go back out to Albertsons or wherever I'm going to go tomorrow morning. To the rest of the board, any more questions? I see no hands raised. Then Vice Chair Trieger.
Yeah,
please.
thank you, Chair. Just really briefly, Commissioner Burney mentioned that he goes to his gym and some people are unmasked, but we currently are still operating under a statewide indoor mask mandate, and so that should not be the case. Is that correct?
That whether it should be the case or not, Commissioner, I was reporting what is the case.
I understand. I'm asking the question.
Yeah.
Chair Farr, Vice Chair Trieger, that is correct. We have a statewide indoor mask mandate.
Thank you.
So we should not feel out of order by suggesting to management of the organization that they are out of compliance.
Chair Farr, I would encourage individuals to let management know.
Perfect. Thank you very much. And nobody wants to be in a fight. You know, we want to avoid fights. So going through the channels is a good way to do it. Don't engage. I would not engage myself. I would ask the organization to engage. That's my personal preference. With that, I see no further questions. Dr. Warren, Mr. Adams, Mr. Mokrahowski, anything else on this subject? Oh, I'm sorry, Commissioner Burney, just raise your hand. Thank you.
Thank you.
Commissioner Burney.
Talking about systems and capacity, I'm going to use this example to point something out. On a personal level, I do ask people to move if they're not wearing a mask, and everyone has been very polite as in that regard in this particular instance. Number two, did speak with the management, and I completely understand how these young people that are staffing gym, they're trying, you know, think of the position that puts them in as enforcer. And I heard some really terrible stories when they did try to do that. Finally, it was reported to Mr. Adams, and it was reported to state, and there's no enforcement whatsoever. I don't even know if there's any communication. So in terms of getting real, these systems aren't fully operative, and just because on the state level, a dictum is announced doesn't mean everybody is following it. It doesn't mean the state has the apparatus to enforce. That's just the reality of that particular scenario.
And thank you for that, Chair Burney. We've experienced that. And I don't want to put a minimum wage clerk or any wage clerk in the position of having to confront people. So really our own personal discipline and our own attitude toward protocol is the best effort we can put forward. Thank you for that.
And I'm not saying it's good or bad. I'm just reporting.
Yeah. So, and you know, the bloke with his mask down and his nose exposed, you know, say, hey, dude, that's like putting your seatbelt around your shoulders and not buckling it, right? So I love examples like that. So with that, Dr. Warren, Mr. Adams, or Mr. Mokrahowski, anything further on the subject? Thank you for an excellent report today. Then we'll move along, and at the sound of my gavel, we will adjourn the joint meeting of the Board of Commissioners and Board of Health, and we will reconvene the meeting of the Board of County Commissioners. We are reconvened as the Board of County Commissioners, and we'll move along with our agenda. And we're moving back to we're back to item 6, which is our consent calendar. Do I have a motion for the consent calendar?
Chair, I'll move passage of the consent calendar for Tuesday, January 25th, 2022.
Thank you. Moved by Vice Chair Trieger, seconded by Commissioner Burney, the consent calendar for January 25th, 2022. Just a note, the items on the consent calendar are covered in detail on our agenda. Just click on view material for full agenda items. Anything that any commissioner can request items to be removed from the consent calendar, and this is the consent calendar as moved forward. With that, I will call for the vote. All those in favor, please say aye.
Aye.
Passes unanimously. Moving along to Health and Human Services, item 7A. I've been excited about this one. This is a status update on progress with unhoused population initiatives. We'll be hearing from Mr. Mokraski. I'll turn this over to you to introduce the panel, but I'm looking forward to hearing from Kate Budd, the program manager, and Ssdi Johnson, two of the most tireless operatives in the county. Mr. Mokraski.
Thank you, Chair. And I will go ahead and turn it over to Kate Budd, our new program manager in the Human Services Division, who's doing a really incredible job. And we've had great feedback from our partners in the community about the work that Kate is doing and the continued work, great work that Ssdi Johnson is doing. I'll just note that we continue to engage with our partners in the community, both public sector partners as well as nonprofit and private sector partners moving forward, understanding that this is a significant priority for our community. And it is an extremely complex set of challenges to solve the overall problem of shelter and housing in our community. Lane County cannot do it alone. And so I think I'll just sort of tee it up with that you know, Lane County has a role, and a really critical, important role, but we also need to rely on our partners in the community. So there will be a lot of work going forward to not only continue, but to advance conversations with various community partners about how we can build on the progress we've made, because we are not where we need to be in solving this challenge. So with that, I'll turn it over to Kate and Ssdi.
And Mr. Mokraski, I failed to mention that Patience Winningham, who is also ridiculously tireless, is also with us. So thank you, Ms. Mokraski, and back to the panel.
There we go. Now I'm unmuted. Thank you so much, Chair and commissioners, for having us today. We are always happy to bring this topic back to you. And we have kind of two sections of it today. So Patience and I will be talking about the All Hazards Shelter Task Force, as well as a project that's ongoing around some cross-departmental collaboration on issues of camping. So we'll go ahead and get started and give you a little bit of an update. As you know, the All Hazards Shelter Task Force was pulled together a few months ago, and appreciate Chair Farr bringing that to the table through the PHB. And we've been meeting for several months and had our first activation since we've started this task force happen over the holidays in December. And so we have a little bit of information about that activation as well as where we're going next. The reason why this committee exists and what we're doing with it is using our blue sky days to plan a response for hazardous weather that has a disproportionate impact on people who are unsheltered, those who are living in places not meant for human habitation, who may not have access to dry clothes or any kind of warmth during cold times, who are exposed to the heat on extreme heat days, and of course are experiencing smoky weather without a lot of options for respite when we have our wildfire season now. So we are working together with a variety of community partners who are engaged in supporting people who are unsheltered and unhoused, as well as helping to beef up and expand the sheltering opportunities we do have, especially leveraging the many years of lessons that we have learned through operating Egan Warming Center and identifying ways we can make that a more sustainable approach, as well as adding other approaches. One of the key things on this is that not only are we talking about shelters, we're also talking about helping people shelter in place during these extreme weather events, because that is often a much safer choice for people who are living without adequate shelter, who may not have transportation to and from the place where they're sleeping at night, and who have a hard time leaving all of their possessions out for anyone to kind of walk by and take. So that is one of the reasons why we're doing this as well. So part of the work is determining our activation thresholds, clarify how activations work, improve expanding that sheltering that I mentioned, including 4 other events besides just freezing weather, heat and smoke events in particular, and of course, responding to any other kind of emergency or disaster. We want to build caches of resources to place in centralized locations so that it's easier for us to distribute supplies to people who are conducting street outreach and distributing those items, life-saving items, to people during extreme weather events throughout the county, and to very much improve our coordination and communication during these events so that it's easier for everyone to do their job and get the life-saving items and or services and supports out to people who are in the elements. We did, as I mentioned, just activate recently at the end of December. I happened to be out of town during most of that activation, was here for the week kind of leading up to it. What was amazing about that particular kind of moment was we did have, that was during weeks when a lot of folks were on vacations. So we did start preparing for this event several days in advance after we knew that there was snow coming. So there were just a handful of folks left in the Human Services Division office, and they all pitched in and jumped in with both feet to make this all happen. We were commandeering different P cards and making sure we could access supplies such as sleeping bags and other materials. We did have a large order from our out of the cold funds, but that had not arrived yet. And so we were able to kind of nimbly get out and get the supplies that we needed by getting some good coordination going the week before the winter weather came. And then while I was gone, Patience and her team did an amazing job of overseeing that activation. And if it's okay with you, Patience, I'd love to have you kind of share a little bit about that and then the lessons learned from that activation as well.
Sure, I'd be happy to. Thanks, Ssdi. For the board, we really had provided situation updates to the Board of Commissioners and department directors. We received those from me anytime we see some sort of inclement weather or potential disaster propping up. And when we started to learn that the activation of the Egan warming centers were going to be opening, we started to message you and let you know what we were doing and our way forward. In my office, we leveraged mass care calls. So we brought in members of the COAD, Community Organizations Active in Disaster, as well as representatives that were available from the Human Services Division and other staff from around the county, and we were doing conference calls to really leverage resources and better understand what we could expect for capabilities and gaps within our response efforts for inclement weather. So we were, this was a first opportunity for us to really shed some light on the work that All Hazard Sheltering Task Force was doing. And it's really, I think, gonna grab hold with some of Kate Budd's staff as well as other staff within the county. This is a tried and true test of the incident command system, and getting those folks involved and working together, I think we're gonna really find a solid way forward. There were some key lessons learned here that I'm happy to go into specifically, Ssdi, if that's okay with you. Things that, you know, the Egan warming centers, they are doing great work, phenomenal work within the urban area, but we need to be including our external area, our rural partners too. So City of Florence had a warming center, City of Cottage Grove, and being sure that we're bringing them all into the conversation when we talk about what's not being met for them. And some of the things that we heard, we did do a quick debrief after Egan stood down and the other warming centers stood down. We talked about when they do close their doors at 9 o'clock in the morning or 7 o'clock in the morning, and they have to push the most vulnerable out into the street in, you know, 2 inches, 3 inches, 4 inches of snow, and it's still very cold outside. Is there a better way to do that at 9 o'clock in the morning? Especially when we know the temperature the next night is still going to stay below the threshold for needing the warming center. So how do we get there from here? That's a bullet that we've put a pin in so that we can look at in the future. Another thing was having adequate access to resources that the county or the state may have available for us, and knowing where those again, Sarai talked about this, the cache of resources around Lane County, having those in spots where everybody knows where they are, and then a clear understanding of what we may be running out of short supply, such as blankets and then laundry services, as well as transportation. That I know there was some snow on the ground, and transporting folks to other locations from our warming centers that were being closed was also a pinch point for some of our community-based organizations. So how do we work together in leveraging those conversations to meet the needs, in those emergencies, I think are huge key takeaways. Pointing our county staff to our community organizations that are active in disaster and working together to leverage what we can do for each other is extremely important, and actively participating in conference calls twice a day, but understanding who to call when they come up short on something. Like the last thing I want someone to be doing is running out of blankets or having to push somebody in a wheelchair out on the sidewalk and leaving them there. How can we help them? So I think those were key takeaways. I look forward to the future and the planning efforts.
Thank you so much, Patience. And thanks for your ridiculously tireless efforts as well.
That was a bad choice of words, but I think it's accurate.
Oh, it's literally the best description of patience that I've ever heard. So yeah, thank you. So yes, the next up on our list of things to tackle with the All Hazard Shelter Task Force is to determine activation thresholds for various types of activation in different circumstances. So for instance, we've had a lot of conversation around events that seem less extreme because they're very run-of-the-mill for us. So if it's raining and 40 degrees or lower, people are at a heightened risk of hypothermia and for potential digit or limb loss. And we actually see that happen a lot during extreme weather here in our own county. So we are looking for how do we activate in times that may or may not seem as much of an emergency as freezing weather or things that we're able to see that are different. But also how do we help people out when they're just living outside and in our climate. So there's that. And then we also Patience has arranged some shelter training. We're collaborating with the Red Cross. This team has contributed to the ESF6 work on how to develop that plan and deploy that plan throughout the county, which has been really cool to see come together. We'll be managing ongoing activations. And then a key part of this work is also going to be supporting and strengthening the COAD community organizations active in disaster to make sure that they have the bandwidth and the resources to connect in with these activations as they proceed. So we'll be working on all of these things in the coming months. And this task force will eventually have kind of these operating standards and a process for how activations happen. We'll get into a rhythm with it. And I think that we'll see some better outcomes for folks who are living in extreme locations who would otherwise be damaged or harmed by extreme weather events. And then finally, another project that's been going on, Lance Inglet in Public Works has initiated cross-departmental collaboration around addressing camping on county property. And so this has been an interesting challenge. Every division and every department, of course, has their own mission and their own goals to uphold. Sometimes those could seem like they're in conflict with other departments or divisions. And in this case, I think we have a really wonderful opportunity to see how we can work together across multiple divisions and multiple departments to identify appropriate policy recommendations to bring back to the board here, as well as developing processes and procedures that we can continuously improve around making sure that folks that, let's say, Dan Woods, one of our roaming heroes in the world, might come across a camp, and then we'll have a process for identifying whether the person is in services, connecting them with any caseworkers or other service providers that they might be already connected with. Working with public health, they've had some good conversations with Dr. Pat Ludke about this as well. And so bringing together all of these pieces and parts so that we can uphold each division's mission, as well as the entire county mission to improve lives, and do that in a way that addresses all of the needs for the community, whether it's health and safety, waste management, and ensuring that our right-of-ways are clear and safe, and the people who might be staying in those locations are also offered safer places to be and can progress along their journey toward permanent housing. And that's what we've got. I'll turn it over to you, Kate. Thank you, everybody.
And thank you, Ms. Johnson. I've come to rely on your accuracy and your clarity of vision. Thank you very much. And Ms. Budd.
Thank you very much, Ssdi, and Patience. I am very much an admirer of the work that you've done and look forward to becoming more involved. And thank you, Chair and Commissioners, for welcoming myself and my team to the board meetings every other month to give you an update regarding our work. I am the housing manager with the Health and Human Services Department, Human Services Division, and am new myself to this role of just a few months. What I thought I would bring to you today would be just what I would consider some high interest information. And then at the end, hope to hear from you about what you'd like to hear from me in the future regarding these every other month presentations. The first thing that I wanted to touch on are the number of seniors who are over the age of 65 and experiencing houselessness here in Lane County. Myself coming from a different community, that's always an age range of interest to me, particularly because we're seeing more and more seniors experiencing homelessness across the nation. What I think is notable here in Lane County are the number of folks, 132, who are over the age of 65. When we look at data in other communities, we see that the number of seniors, once they reach the age of 65, tend to reduce, and there's a much larger number between the age of 55 and 65. But here in Lane County, that number doesn't wane. It continues to remain high once someone crosses that age 65 threshold. And so I think it's something to note and something that I will certainly continue to pay close attention to. Among the 132 individuals who are houseless in our community, many of them, 32 in particular, are experiencing chronic homelessness, and that they've been homeless for at least a year or many episodes through a period of 3 years, and therefore are eligible for permanent supported housing, our highest level of intervention here in the community. We also have among those 132 individuals, 8 veterans. And so I know that our outreach teams are working on connecting them with the many veteran resources in this community, as well as 4 individuals who are eligible for rapid rehousing, which says to me that they have higher levels of housing barriers and will need very intensive supports in order to get into permanent housing. The other folks that are not waiting for these higher level supports are engaged with our outreach teams, and they are working on first meeting their basic needs, as well as working to move them into shelter and longer term housing options. The next piece of information that I find interesting are the number of people who are engaged in our many homeless support systems across the county who are identifying as having a disability. When we ask folks to self-identify, we do find that there are many people who are not interested in identifying that they have a disability, and that can be an invasive question, and so that reaction is understandable. But we do have approximately 39% of those who have engaged with our homeless support services who have identified as having a disability, and that can be an interesting piece of insight regarding the needs of our neighbors who are houseless. So to take a closer look at that information, you can see that it's broken down by identified disability. Please know that someone can be represented in many of these different columns. And what comes up most often when people self-identify their disabilities is that they have a mental health disorder, followed by a physical health disability, or having chronic health conditions. And chronic health conditions often go hand in hand with having a mental health and or physical health disability. One point that I also think is notable to to share is the number of folks who have identified as having a developmental disability at 8%. And that is a rather high percent compared to other communities that I'm familiar with, particularly because there are so many resources available to folks who have developmental disabilities. And so that indicates to me that we want to drill down further and make sure that we have outreach teams focusing on those folks who identify as having a developmental disability, to make sure that they're engaged in all the available resources that they may be eligible to receive. 6% of folks identify as having a substance use disorder, and that encompasses both drug use and alcohol use. We also know that every single one of these self-identified disabilities are underreported, and that if we were to look at health records, for example, that there would be likely a much higher rate of disabilities among folks who are experiencing homelessness. So when we think about this higher number of folks with disabilities and seniors, one new program that is being created that will help address the needs of folks who are unhoused is the Shinkle Shelter that's located on Brooklyn Street in the Glenwood area. This used to be a safe haven facility for years, funded with continuum of care dollars. And since the beginning of COVID, has been involved in a rehabilitation efforts to completely gut the building and bring it back to its former glory. It was formerly the Beth Temple Church, and it was run by Reverend Arthur Shinkle, who not only was a pastor there, but also one of the first African-American members of the Oregon Carpenters Union. And so a very esteemed past. And so not only is that shelter named after the Reverend, but it will also, once it opens back up, be a home to 12 individuals who are over the age of 65 and have priority health conditions. And so really excited to see this facility open up. And it will very much be a safe haven for seniors and an opportunity to help increase their overall quality of life. A little bit more regarding that Shinkle facility. On the inside, it's a very large building, which is exciting because there's plenty of space for the residents to be able to move around and share and break bread, as well as to find space to themselves. Plenty of space for the staff who will be supporting those individuals. There are 7 resident rooms, and so a few folks may have their own room, while others will share a room with their residents. Outside is really impressive. It has a large backyard. It has a beautiful patio area, garden beds, room for bike storage, as well as a large storage shed, and then plenty of parking for both the residents and staff. The 12 residents who will reside there will very much receive whole person supports, or holistic care, as you often hear. There will be case management available, very much focused on stabilizing housing for the residents, as well as their health, and connecting them to behavioral health supports and physical health supports within the community, focusing on what's next and how can we reduce the housing barriers that someone might have so they can move into permanent housing and realize even greater housing stability. We want to make sure that they're being connected to all the different resources that they might be eligible for through DHS, veteran services, healthcare, et cetera, and then other community supports. And so if continuing their education is something they'd like to do, or they're in need of legal services or credit repair, those are things that the case managers can connect them with. We will also have a Soar certified staff, and that stands for Ssdi, Outreach, Access, and Recovery, which is an evidence-based model through SAMHSA at the federal level. and it helps connect people to Social Security. And so if for any reason the residents are not receiving their full eligible amounts, then the SOAR staff can help them with that. And then lastly, we're building a stronger partnership with Lane County Senior and Disability Services. And they have very much been interested in coming to the table and talking about what are our gaps and how can they help address those gaps related to assisted living, related to connections to services, as well as care. So we're looking forward to really hashing out what that partnership can look like for the 12 residents of this facility. The request for proposal for the operation and services of this facility are open now. And so if anyone happens to be interested in taking a closer look, we will share the link with this PowerPoint after the presentation. It is due on February 25th at 4 p.m. So the last thing that I wanted to make sure this body was aware of is the point in time count for 2022 will be happening officially on Thursday, January 27th. So just in a few days. We will be conducting the point in time count a little differently than the way that we had before COVID. For a few reasons. One being that we want to be conscientious that Omicron is still spreading and that putting volunteers face to face with folks who are houseless could be a safety risk. And so instead of doing a full-fledged volunteer effort as we have in the past, we're instead going to rely on our Lane County by name list. And this is a list that comes right out of our homeless management information system that encompasses anyone that has touched any of our local homeless support services, whether it is for people who are experiencing homelessness or just for people who are at risk of homelessness, that if they identify as being houseless, they will be on that list and counted for the point in time count. And so we found that that by name list is quite accurate regarding the overall number of people who are experiencing homelessness. But because we recognize that not everyone will be on that list, throughout this whole week, our many outreach teams in the community will be out exploring different areas that have been recommended to us through different systems of care, such as the sheriff or police officers, the ODOT partners, Forest Service, Parks and Rec, our local agencies, so that they can survey folks who may not regularly be involved with the different services in the community. And so we really appreciate all the work of our team here at Lane County, as well as our team and partners out in the community that will help us have an accurate count for our point in time count. We predict that we should have the point in time count information out in April or May, just in time for it to be due to HUD. And we'll be sure to share all that information with you once we've collected it. So finally, the last thing that I wanted to do with all of you is just to check in and see how we can best use our time together every other month and what type of presentations or information you might be interested in receiving and discussing further.
Well, thank you for the presentation. We allowed 45 minutes today, commissioners, and we did start on time. We have an 11 o'clock time certain that we should be on time for, which gives us about 15 minutes for questions and further presentations. I will note that Eve Gray, Ms. Eve Gray, who is the head of Health and Human Services, is with us today. Also, Mr. Steve Manella is with us today, who is the longtime head of our Human Service Division. So any further items on the presentation, Mr. Mokrajski and panel? Seeing none, with your indulgence, I will move ahead with questions from the Board of County Commissioners. And I'll state this: thank you for ongoing presentations to the Human Services Commission. Very robust discussion that was held yesterday at the Human Services Commission. First in the queue today, we have Commissioner Buck. Commissioner Buck.
Chair, I appreciate it. I'm sorry, Mr. Mokrajski, did you have something to say you wanted before questions? No, Okay.
No, I'm just here if you have questions. Thank you.
Okay. Thank you. I want to appreciate having the combination of housing and emergency services. Last summer when we had the heat dome, and we were thinking about what's going to happen to all those people on the street, the first person I called was our emergency manager, because I felt that was actually in the category of emergency management. But we all know that each of these things touches so many other aspects of our worlds. And it is greatly appreciated that we have some more concrete working documents and conversations about all hazards with our emergency manager specifically. So I just want to give you kudos for doing that really important work, and knowing we have different contexts and different contexts of the work that we do. And this involves more than just one service that belongs to the county. When it comes, actually, other than that comment, I have a question on those that are 65 and older specifically. It is my understanding that many of them are our most vulnerable, have disabilities, are older, are currently in hotels or motels. And the challenge there is the funding for those, I think provided by the city of Eugene, but please clarify if that's not accurate or if we're participating in that funding. May have been part of the CARES Act funding that will be going away or being spent down by this summer. And we are, of course, looking for other places to locate them. And so I'm wondering what the status is of that. I just don't want to see these folks out on the street in a couple of months because our funding has been washed away, and that we have a strategy to keep them sheltered.
Chair Farr, Commissioner Bush. Kate, do you wish to answer that question, or do you want me to?
You're welcome to.
Okay. So the status of the hotel program is that we have 112 rooms in 2 different facilities, and the operational funding for the motel program comes from FEMA as part of the COVID emergency. And then the case management and other supportive services that are provided at those motels is funded by Emergency Solutions Grant coronavirus funds that end in September of this year. Staff is currently looking at the potential to extend from June 30 to September 30 the existing contracts. There's been some discussion. One of the facilities was considering opening up for the World Games to commercial tenants. The other possibility we've been looking at is one of the motels is interested in a maybe a longer term lease of the facility. So we're investigating that possibility. We also have resources to assist with transition, and specifically, Kate sort of alluded to it, but specifically we've looked at the along with our operator, we've looked at the data on who we're housing there, and you're correct. We have some people who have some very significant chronic conditions, and we're looking at prioritizing those if we're able to secure a lease on one of the 2 motels to house them further.
Thank you, Ms. Manila. And pardon my moving us directly along, Commissioner Buck. Thank you for the questions. I'll come back if we have further time. We have about 10 minutes before our time certain, and we are all in the queue. My questions can wait till later. We have Commissioner Bozovich, followed by Commissioner Trieger, then Commissioner Burney. Commissioner Bozovich.
Sorry, thank you. I'll try and be quick. First, I just want to say I appreciate the report on the Shinkle Shelter and the fact that it's going to be a whole person support. That's a really important aspect to me, to have that case management go with the shelter. A couple quick notes on the camping response slide. The one thing I saw missing from the list of divisions was public safety. And I think we still need, with the millions of dollars we're spending to shelter and help these folks, we need to have them be accountable for not creating public safety issues and furthering that mission at the same time. I appreciate the focus on seniors in this presentation. The one thing I'm concerned about is there's a local organization that's appealing many temporary hardship dwellings out in the county that are intended for seniors to be taken care of by family, and have actually, and I know of one case, successfully appealed a decision and forced it up to higher levels of the land use system, where the seniors had actually sold their home and are now in limbo because they can't move on to their children's property. This is a temporary dwelling that this group continually appeals. Somebody needs to talk to them about compassion. But that beside the point, the big question you asked, and the one I want to answer, is what do we want in future presentations? I have a great concern that we're spending millions on this particular issue, yet we haven't established outcomes to be measured and analytics we want to see. And I would love to have a presentation on how, what outcomes we want out of these programs, how we're measuring them, how we can wrap that into our actual contracts, and getting regular reports on the analytics of are we making progress? And which programs are the most effective, where we should be focusing. So that for me, in some of those 5 future presentations throughout 2022, we could spend a whole afternoon just on that subject, I think. So yes, that's my answer. So thank you.
Very incisive, Commissioner Bozovich. Thank you very much. Vice Chair Trieger, followed by Commissioner Burney.
Thank you, Chair. Thank you very much for the presentation. In the interest of time, Ms. Budd and I have a one-on-one coming up soon, as do I and Eve Gray. So I'll chat with them a little bit about future presentations, but some of it will be along the lines of what Commissioner Bozovich mentioned. I know at the HSC and the Poverty and Homelessness Board, we get great data from Lisa Stewart that shows us the inflow and outflow and so on. So maybe something along those lines. Speaking of data, I'm very curious if specifically around the activation thresholds for EGAN, if we are collecting, or if we have someone who can even use almanacs to give us historic data to say, were we to increase the threshold to include a hypothermia threshold, to include rainfall and so on, basically to help us identify the gap of the true need for that system, rather than sort of adjusting an activation threshold to what we think the capacity of the volunteers and the network is to deliver the emergency sheltering. That gap would be really important to know. Similarly, the seniors on the coordinated entry wait list, do we have a sense of how many 65 and over folks are unsheltered and unhoused who are not on the coordinated entry wait list? So knowing what those gaps are would be really important to me. I also very much appreciate the presentation about the Shinkle and the Soar aspect in particular, to make sure people are getting the benefits that they're eligible for, that should be coming to them from the federal government. What's such an opaque system, and for that population especially, really hard to have the tenacity to stick with getting those. So thank you for that piece of that. And finally, as Commissioner Buck mentioned, I also am very happy to know that we're doing this integrated approach with emergency management. And the particular reason, there are many, but the particular reason I want to flag for that is around the heat dome kind of events. We are so focused, and rightly so, on people who are sleeping rough, who are unsheltered. But we know that with heat dome events in particular, there are actually lots of people who have shelter, and it's the shelter that increases their danger, their risk of negative impacts from a heat dome. So that would be people in, mobile homes, people in top floor, high floor apartments without any kind of cooling or adequate ventilation. And just generally, this issue of how much substandard housing we may or may not have, but we don't know because we don't have housing habitability standards and track that. So hopefully this integration of emergency and disaster preparedness and planning integrating with our homelessness response will help us sort of suss out some of those opportunities, start evaluating the habitability of housing and who's at risk for what kinds of impacts because of that. Thank you again.
Thank you, Vice Chair. Thank you, Vice Chair Trigger. I'm going to add this, Commissioner Burney, before I turn to you. Next time we have this presentation, we'll have it for more than 45 minutes because this is a wonderful conversation. Great presentation. Commissioner Burney.
Thank you, Chair. I forgot what I was going to say, but also I thought of one thing. First, I want to thank everyone for the presentation. I know that your work is devoted to this. So when I make statements that are going to sound crude or rough, there's no disrespect intended. My response to Ms. Budd's question, I believe that it's much easier to describe a problem and to describe the demographics of a problem than it is to solve a problem. So I'm more interested in less time spent on telling me about what this population looks like, because I feel like I've heard it multiple times, and more time spent on how we're going to provide shelter for all and how close we're getting to that. Quantitative impacts. Number two, I've been actually Councillor Moe of Springfield, who grew up and has lived his entire life in Glenwood, has taken me through the Shinkle Center back when it was operative. I've spoken to residents there. You spend a lot of time on that. I'm glad that's happening. It used to kind of happen, a little less formally anyway. I'm glad that I think everyone knows, I know that wraparound services dealing with the whole person and the whole problem are a lot more effective than isolated interventions. Appreciate that. I'm so much more interested in impacts personally, and number of people we shelter and how we do that. That's really all I have to say, and that's my answer to your question, Ms. Budd. But that's me. Thank you, Chair.
Commissioner Berner, thank you. You've allowed me about 60 seconds to say something in response to you and Commissioner Bozovich. One way that we can find out how we're doing is by measuring, is by using analytics and providing a continual measurement stream as to how we're doing in particular areas. First, we need to identify the pillars we want to measure and the ones that are most descriptive of the effort that we're putting in and the results that are being achieved. And I agree with you, Commissioner Burney. We'll focus on what to do and not what has been done. And 20 years ago, we did a lot of hand wringing, by my estimation. Today, boy, the activity is all over the county. So we have about 2 minutes. Ms. Gray, I'm going to look directly at you. You're the head of Health and Human Services. If you have a summary, or if any of your panel wishes to provide a quick summary before we go to our time certain.
I will just take this moment to appreciate this team, because these are some really, really bright individuals who are working on this problem. We will definitely take back the feedback on data and measurable outcomes, and then defer to anyone else on the team who'd like to make a comment.
Thank you, Ms. Gray. And we have a moment. I see no one.
Sarah. Really appreciate the feedback and certainly understand the interest in analytics and what are the measurable outcomes that we are tracking, and then how are we doing in moving toward those identified outcomes. And so just sharing that I hear you, and I look forward to providing you with that information moving forward.
Superb. Well, thank you very much. We will conclude this on time and provide more time next time.
I do see Commissioner Buck's hand is up, Chair.
I see that in the top left there, Commissioner Buck.
Just quickly, as a follow-up to my original question regarding our seniors, and thank you, Mr. Manila, for answering that. But unfortunately, it sounds like we still have an issue of housing these people come September, and I'm hoping we can hear back on how that is going in the future. And Chair, I just want to add, I am still frustrated that we don't have enough time to ask more questions on this particular topic. So I'm hoping when we talk about housing and our unsheltered needs in the future, we can still try to add some more time. Thank you.
Thank you, Commissioner Buck, and that has been noted. Very well, then we'll conclude, Mr. McRice, we'll conclude this item, and we will we'll recess the regular meeting of the Board of County Commissioners. And Ms. Jones, with your indulgence, apologetically starting at 5 minutes late, I'll convene the executive session in 5 minutes at 11:05. We are in recess.
Now, Commissioner Farr?
Yes.
We
I'm
do
here.
need to read in executive
Oh,
session.
thank you very much. Will you read us in, please?
I never made that mistake.
Darn it, I was on a roll.
Get it up.
Are you going to read it or am I?
I can read it if I have it up now. You ready for me to read it in?
Please, thank you.
Okay, this is executive session for Tuesday, January 25th. And the Board of Commissioners will meet in executive session to conduct deliberations with persons designated by the governing body to carry on labor negotiations. This executive session is held pursuant to ORS 192.660(2D), which allows the Board of Commissioners to meet in executive session for the purposes listed. Representatives of the news media and designated staff shall be allowed to attend the executive session. All other members of the audience are asked to leave the room. Representatives of the news media are specifically directed not to report on any of the deliberations during the executive session, except to state the general subject of the session as previously announced. No decision may be made in executive session, and the board reserves the right to come back out into public session should the need arise.
Thank you, Ms. Jones. At the sound of the gavel, the Board of Commissioners will be in recess and we will reconvene at 11:05 in executive session.